Now let's talk about a very important topic in ADHD, which is the etiology of ADHD. Now, when we talk about the etiology, multiple factors may play a role, and many times there may be integration of many of these factors, which ultimately lead to development of ADHD. So, the factors which we are going to discuss, we'll talk about under these headings. So, we'll talk about genetic factors, some important genetic studies, some important genes which have been identified. We'll talk about that. Neuroanatomical factors, again, we'll also try to understand some of the hypothetical neuroanatomical area circuits related to the symptoms. So we'll try to correlate with the symptoms. We'll talk about important neurotransmitters, dopamine, norepinephrine, which have been again proposed for responsibility of ADHD. We'll talk about environmental factors. Some of the environmental factors may also be responsible for ADHD, and some dietary influence. There is, again, it's controversial. We'll talk about some of the dietary factors as well in ADHD. So let's talk about the first important factor, that is the genetic factors. Now in genetic factor, it is seen that the heritability index for ADHD is 0.6 to 0.98. That is, again, it has a high heritability index, and it has been seen that many genetic disorders may have ADHD-like behaviors, such as in Fragile X syndrome, in neurofibromatosis type 1, Digeorge syndrome, tuberous sclerosis, Turner syndrome, Williams syndrome, Angelman, and Prader-Willi. So these are some of the important genetic disorders which have been seen and may have symptoms similar to ADHD. So there may be some genetic overlap in these disorders. So genetics again play an important role. The twin studies suggest that the variance in transmission of ADHD, which is attributing to genetics. So again, the genetic factors attributing to ADHD is very high. It is 76%. In fact, ADHD is one of the most common or one of the most heritable psychiatric disorders. So genetics play a very important role in development of ADHD. Again, some of these data are important, especially when we are planning for any MCQ exam. Now, twin studies also show that the concordance rate in monozygotic twins is around 59 to 92%. You can remember 60 to 90%. While in dizygotic twins, it is 29 to 42%. Again, you can remember it to be 30 to 40%. So again, you can see that the concordance rate is high in monozygotic twins, again, which is suggesting that genetics play an important role in ADHD. Now, in sibling studies, it has been shown that MRI in ADHD subjects and their unaffected siblings, if we MRI were done, and it was shown that there is a decrease in volumes in the right prefrontal gray matter. Again, prefrontal cortex play a very important role. We'll talk about that. And even volume is decreased in the left occipital gray and white matter. So you can see both in the child with ADHD as well as the unaffected siblings are having reduced volume, again showing that there may be some genetic cause in the ADHD. Adoption studies, again, it was shown that the biological relatives of hyperactive children are more likely to have hyperactivity than the adoptive relatives. So again, this is suggesting when we talk about nature versus nurture. So again, genetic factors may play a more important role than the environmental factors in ADHD. Now, in family studies, it is seen that the first degree relatives of children with ADHD, such as the siblings, they are 2 to 8 times more likely to have ADHD. So again, it is seen that the risk is around 20 to 25% for ADHD in the first degree relative as compared to the control, where the risk is around 4 to 5%. So again, genetics is, this is suggesting genetics play an important role. And if one parent has ADHD, again, it is seen that 50% offsprings of the couple are likely to have ADHD. So again, these are some important data which one should know related to ADHD. Now, coming to the mode of inheritance, again, there has been many hypotheses which have been suggested. One is it a sex-linked disorder? Again, as we know that it is more in males than females, so one hypothesis is it may be a sex-linked disorder. Again, there is a certain hypothesis that there may be polygenic inheritance may be seen, and generally evidence suggests that ADHD may have several interacting genes of modest effect, which subsequently play a role in development of ADHD. Let's talk about some of the important genes which are currently being identified. First gene let's talk about is the DAT1 gene, that is dopamine transporter gene. Now it is seen that this gene codes for sodium dependent dopamine transporter protein, which regulates reuptake of dopamine from the synaptic cleft. And it has been seen that this gene is again involved in ADHD. In fact, it is seen that this gene may be more associated with inattention. In fact, it is seen that this gene may be more associated with the hyperactivity, impulsivity subtype or the combined subtype. So less with inattentive type, but more with hyperactivity, impulsivity or combined subtype, it may be more associated. Another important gene, so this is one gene which you should remember. Another important gene which has been again identified is DRD2. So this gene basically is a dopamine type D2 receptor gene. Again, it has been now in studies, it has shown that it may not be that specific to ADHD and may not be believed to be a primary cause, but this is one more gene which has been identified. So these are two genes. Some other genes such as DRD4. So DRD4 is dopamine type D4 receptor gene. Again, it is also linked to novelty seeking and impulsivity in ADHD, and it may be related to the inattentive subtypes. Another gene, that is SNAP25. Again, it encodes for a protein which is involved in neurotransmission, and it has been seen that SNAP25 is associated with sensitivity to methylphenidate. We'll talk about methylphenidate, which is a stimulant which is used in ADHD. So it is associated with the methylphenidate adverse events in preschoolers with ADHD. So again, SNAP25 may be associated. Many other genes have also been identified again, but we don't have enough evidence to prove that they are involved in ADHD. Some of these genes include DBH, that is dopamine beta hydroxylase, catechol O-methyltransferase COMT, then SLC6A4, it is a serotonin transporter gene, and SLC6A2, which is a norepinephrine transporter gene. So again, you can see some of the important genes related with dopamine are under investigation or are being hypothesized to be responsible, and some of the genes related with norepinephrine and even serotonin may also be implicated in development of ADHD. So this was about important genetic factors which may play a role in ADHD. Now let's talk about neuroanatomical factors. We'll talk about some of the important studies, imagings, structural and functional imaging, which have shown evidence that neuroanatomical factors are responsible. We'll also talk about some of the important hypothesized area which correlate with the symptoms of ADHD. So for a better understanding in what all circuits may be involved in development of ADHD. So in MRI findings, it has been seen that there are various structural abnormalities which have been seen in children with ADHD involving areas such as the frontostriatal areas, temporoparietal lobes, cerebellum, basal ganglia, corpus callosum, amygdala, hippocampus and thalamus. So many of these areas are involved in shifting attention, in executive functioning, which and controlling impulsivity, and also related with the activity, so movement. So many of those areas which are involved may be responsible for the symptoms in ADHD. Also, it is seen that in the diffusion tensor imaging, that is DTI, white matter tracts abnormalities and dysfunctions, dysfunctional connectivity is seen in ADHD. So many of the circuits which may be abnormal, we talk about some of the hypothesized circuits which may be responsible for ADHD. In the functional imaging in fMRI, it is seen that there is a decrease in the frontal lobe activity in children with ADHD. Again, frontal lobe plays an important role. We'll talk about frontal lobe as well. So these are some of the important studies involving the imaging which have shown that certain anatomical areas may be responsible for ADHD. Now, in the electroencephalogram, that is in EEG studies, it has been seen that the beta to theta ratio, that is TBR, is increased in children with ADHD. Now, this increase in beta, it especially is seen with the combined type, and also it has been seen that this beta may also be increased in children having mood lability or having temper tantrums, and those also there is increase in beta. Also, this increase is also seen in some of the disorders such as substance use disorder, even bipolar disorder. So again, it's not a reliable diagnostic measure. So for diagnosis, it may not be as much used, but it has been seen that EEG findings may have prognostic value. So they may have prognostic value, especially for treatment outcome. So we can see the pre and post EEGs. We can compare, and it may help us in prognosticating the treatment which is being given. So it may have some prognostic value in the management. So these are some important EEG findings which may be seen. So now we know, let's try to correlate some of the neuroanatomical areas, and also along with that some of the important neuroanatomical structures or circuits related with the symptoms. So we know the core symptoms of ADHD includes inattention and hyperactivity, impulsivity. This inattention can subsequently be divided into two. So one is selective attention, in which the person has to focus on a particular stimulus, and subsequently another type of inattention may be sustained attention, problem in sustained attention or problem solving, which you can correlate is basically related to executive functioning. So inattention can be two. One is problems in selective attention as well as problem in sustained attention and problem solving. Usually selective attention is tested by what is known as Stroop test. So in Stroop test, the person is shown various names of the color which are written in different colors, and the person has to name it which is written. So for example, the person may be shown this word black. So black is written in a yellow color. So the person has to read it as black. That is the name which is written. So various such words are written in different color, and this, if the person is able to do that, means his selective attention is intact. While executive functioning or executive dysfunctioning would mean that the person is not able to sustain attention which is required for solving a problem. So there is problem in executive functioning. Generally, executive functioning, it is tested by what is known as N-Beck test. So in N-Beck test, a person, so there are various variants. So in a zero-Beck variant, the person has to press a button when, after a single digit number. So this N-Beck test has various variants. One is a zero-Beck variant, so in which a person has to press a button if he sees a single number. So every time there is one number, he has to press. Then there is a one-Beck variant. So here the person has to press after seeing the second number. So again, this may increase, and more the N value. So more the N value the person is able to perform, it means that it is a more difficult level the person is able to do. That means better is the executive functioning. So these are two tests which are used to check these attention deficits. So let's try to now understand some of the important areas which are implicated in these symptoms. It is seen that the selective attention, the area that is dorsal anterior cingulate cortex, that is DACC, that is responsible for selective attention. So deficit in dorsal anterior cingulate cortex may lead to attention, that is selective attention deficit. Then executive functioning, as we know, that is a sustained attention problem solving, is related with the dorsolateral prefrontal cortex. So many of the executive functioning is because of dorsolateral prefrontal cortex. So if that is abnormal, it may lead to problems in executive functioning. Hyperactivity may be due to prefrontal motor cortex, while impulsivity may be because of orbitofrontal cortex. In fact, it is also implicated in impulsivity related with various other disorders such as in substance use disorder or even in suicide. So this may be implicated in other disorders having impulsivity. So this is in fact, if you can see, there is a shift, there is a categorical classification and there is a dimensional classification. This is the uniqueness of dimensional classification, wherein these symptoms can occur even in various other disorders, and we can correlate with the area which is being implicated in the development of these symptoms. So these are important areas which are hypothesized to be responsible for symptoms in ADHD. Now in ADHD, it has been seen that there is a insufficient activation of corticostriato-thalamocortical circuit, CSTC circuit. So basically this circuit, it starts from the cortex, goes to the striatum, subsequently to the thalamus and back to the cortex. So it has been seen that there is problems or insufficient activation of this circuit, which leads to development of symptoms. So let's try to understand some of these symptoms and which are the circuits which are affected. So in selective attention, it has been seen the circuit from the dorsal anterior cingulate cortex to the striatum to the thalamus and back to the cortex. Again, this is implicated. While in executive functioning, it starts from the dorsolateral prefrontal cortex going to the striatum to the thalamus and subsequently back to the cortex. So again, this circuit is implicated. Now in hyperactivity, the circuit starts from the prefrontal motor cortex going to the putamen, that is the lateral striatum, to the thalamus and back to the cortex. And in impulsivity, it is from the orbitofrontal cortex to the striatum, to the thalamus and back to the orbitofrontal cortex. So these are the important circuits which are implicated in development of the symptoms. Now basically what happens in ADHD, so there is these areas such as the PFC areas, they are not sufficiently activated in response to any task and subsequently leads to the symptoms. So again, we'll talk about the symptoms, we'll just try to understand. So some of the symptoms of inattention, which is basically due to selective attention deficit, the child may appear distracted, the child may appear more forgetful and maybe making more careless mistakes. So many of these symptoms which we'll discuss in inattention are because of problems in selective attention. Then problems related to executive functioning, the child is not able to organize. So executive functioning is impaired. So there is more of disorganization. There is a poor time management. The child is not able to finish the task, and there may be avoiding a certain task which requires sustained efforts. So some of these symptoms of inattention may be because of problems in sustained attention and problem solving. While symptoms which we will discuss in hyperactivity, such as the child is very fidgety, fidgets a lot, the child leaves the seat when remaining seated is expected of them, for example in a class, or the parents, teachers, they may say that they are always on the go, they are always moving. So these symptoms are again because of hyperactivity. And in impulsivity, the child may do certain things action without reflection, so without considering the consequences. So the child may not be able to wait for his or her turn. They may interrupt others while they're speaking, or they may just blurt out answer even if the question is not finished. So some of these symptoms, again, they are related with the impulsivity. And so this is some of the areas which we've talked about, the core features of ADHD and some of the important areas which may be responsible. Even some of the associated symptoms we'll talk about ADHD, which may occur in children with ADHD. Again, let's try to understand some of the important areas which may be implicated. So it is again hypothesized that there is insufficient tuning from the ventromedial prefrontal cortex to the limbic circuit, to the limbic system, and subsequently it leads to various symptoms such as mood instability, mania or anxiety. So subsequently we'll talk about that. A lot of children with ADHD may have mood disorders like bipolar disorder and even anxiety disorders. Then children may have cruelty or may get into fights. So conduct disorder may also be seen, and they may be argumentative, disobedient. So oppositional defiant disorder, ODD, may also be seen. So some of these symptoms may be associated with this circuit. So these are some of the important symptoms which we have discussed and their relation with the anatomical areas.